So if I were interviewing you on behalf of the New England Journal, which I'm not, but if, and I were to ask you how to compare the world of medicine and the world of human life about the time you were beginning to think about going into medicine, and how that has changed to the way it is today. And what would your vision of the future be? How would you kind of compare those three nutshells? Past, present, future.
Well, I think as we've evolved,
your lifetime.
As a general society, I think we've evolved to one in which there was much more attention and value being placed on the individual. There is much more connectiveness between people in different locations. And I think we have evolved to a situation, to give you an example, if we look at education, 100 years ago, the Industrial Revolution generated assembly lines, standardized parts, standardized products, and quality measures that basically included how close does everything meet the tolerances of the manufacturer. As a society moving concurrent with that, we developed educational systems in which kids move stepwise along the 12-year or 13-year gradations and possibly into college. They sat in rows, they studied standardized books, a standardized curriculum, and they took a standardized test, and their quality was measured on how well they met this certain standard. What we see today is that we have, through the ability of electronics, through the much more dynamic way of dealing with information, we have products that are customized. We have organizations that have gone from being a large factory to being dispersed and essentially operating to standards that allow a variety of suppliers to provide components to something that gets turned out and sent to an individual to their particular standards. It is a much more dynamic situation, and what we're seeing in schools is that people are moving towards a situation in which they progress based on their abilities. Their coursework is tailored to their pace and to their ability to understand. And we are not there yet, but the move towards evaluation is moving away from standardized tests and more towards what people can accomplish and how far they have come to measure their success. Within medicine, you are moving less towards, we have gone from treating people based on your best hunch to running on guidelines and protocols, and we are currently at the high tide of that particular approach, which and we're looking at physicians practicing in large organizations, medical factories, if you want to think of them that way. But there is a trend towards adapting to patient preferences, to adapting the practice of medicine to the individual preferences of the physician, to looking at the guidelines and saying, how can this be modified to the advantage of this individual patient? And how can I measure that based on this individual patient's outcome, as opposed to some large standard? So we're moving, I think, phased off by perhaps a generation from the rest of society. Medicine is moving towards something that is much more tailored and much more integrated with individual values.
So you talk about tailoring. The field of genomics is likely to have a major impact on obstetrics and gynecology and pediatrics and everything else. Do you have some thoughts about that and where that's going and the ethics of all that?
Well, I think this is one where history
impact
comes in and plays a big role, in my opinion. I'd mentioned to you the notion of standardization and factories and assembly lines 100 plus years ago. There was another thing happening at that time in that Mendel discovered the concepts of genetics, and the idea of inheritance became better understood. And along with that came notions of heredity as a predetermination of what one's capability was. And again, looking at the assembly line and the fact that everything that falls off the end of the assembly line is supposed to look the same. If you had people who are developing differently, who look differently, they were not as valued. And many people thought that they were thinking in a very forward way if they said, we need to eliminate people who have this trait or that trait. And so the concepts of genetic engineering have a history. And this history tracks back to a time when a lot of decisions were being made regarding sterilizing people who were felt to be mentally retarded, institutionalizing people who didn't behave the way people expected them to, and that sort of behavior, leading up, in fact, I think, to some movements during the 1930s that led to some terrible outcomes in Europe and elsewhere. So I think we need to, if we're thinking today about genetic engineering, and we're thinking today about unintended consequences and things like that, that we need to approach things with the humility that the best minds, applying themselves to the best science at a particular moment in time, realize some insights and some benefits, but also triggered a domino effect that led down some paths that were not what they had intended at all. And so I think when we look at the field of genetic engineering, I think we have to think very carefully about the concept of unintended consequences. We have to approach it with the humility that there are times when you adjust one thing and something else happens. And this has to be approached with great care.
So we're moving at a time of many, many choices.
Right.
The ability to actually transform our entire biosphere, the nature of the human person. Your interest in data, we have information technology, even quantum mechanics affecting how we handle knowledge.
Right.
The internet connects us to everyone in the world. So are you optimistic for the future, or are you a pessimist?
No, it's absolutely, the future is going to be better, just as the present is so much better than the past. When I look at medicine that I was taught to practice when I started in my career versus the medicine I was practicing as I retired, there were so many better tools, better drugs, better diagnostic tools, better ways of keeping records, and people were doing better. Conditions that were fatal became curable. Conditions that were disabling, became remedied in a much better way. Surgeries that took a week in the hospital to recover became outpatient procedures or were treated with medication. And so I have lived to see things improve tremendously, and the trajectory, in my opinion, is just getting better and better.
So in preparing for this interview, I read some of your speeches.
Mm-hmm.
And there was one where you quoted someone. And I'd like to read it.
Okay.
Because I think it's rather prophetic of you as a human being. And it's by Goethe. And it was in a talk you gave a number of years ago. And he said, "Knowing is not enough. We must apply. Willing is not enough. We must do." And I think you, in your life, personify that profound notion. So, what advice would you give to a young person walking into this room, say a teenager who has an interest in science, an interest in humanity? What advice would you give them about their prospects for the future?
I think there are a lot of opportunities. I still think that there's no better profession than medicine. There was no better profession than medicine for me. And that the pleasure is in the doing, and the ability to look at what you've done and be able to say you made a difference. So I think medicine provides that opportunity. I think if there is one caution to that, it is that one has to consciously make decisions to control the space around you, to control the trajectory of your career. You can be very easily drawn into just being consumed by your practice or your career, and that there are so many other opportunities which allow you to broaden yourself, to learn more, to do better in each field because you can cross-pollinate a little bit. And so that mindfulness of being able to allocate little portions of time to different things is very important.
So Dale, thank you for sharing your perspective and your wisdom and your experience with us today.
I've really enjoyed this. Thanks a lot, Jack.
You're welcome.